Discretion is advised.
7, 8.
I don't feel so
You're
good.
just nervous about tomorrow. Just keep up the intensity.
I think I need to sit down.
Just run through it one more time from the top, okay? Just one more time.
One more time.
Five, 6, 7, 8. 1, 2, 3, 4. 5, 6, 7, 8. 1, 2, 3, 4. 5, 6, 7, 8. 1, 2, 3, 4. 5, 6, 7, 8. 1, 2, 3, 4. 5, 6. Rachel, are you okay? Are you okay? What's wrong? Oh my god! Oh my god, you're bleeding! Oh my god! Call 911, somebody! Oh my god! Honestly, why do you always do this?
Kids just don't appreciate music these days. The patient collapsed while at dance practice. When EMS arrived, the patient was in a hyperfusional state and showed signs of hypoxia. Our dance instructor said she was complaining. Have you ever heard the expression ego opera non tutiva? No. It means I don't care. Great, what do we do now?
Well, the patient presented with pyrexia, hypertension, and renal infarction. I think she has myeloma.
Jumping from kidney failure to cancer of the plasma cells is quite a leap, isn't it?
How when you consider her blood test showed she had hypercalcemia, elevated creatine, and BUN. If that wasn't enough, her hemoglobin level is 8.6 grams per deciliter.
That's right, myeloma is crap.
And I'd be willing to bet a radiograph would reveal bone lesions.
If that's the case, we should start her on dialysis immediately. Give her ACE inhibitors to lower her blood pressure. She'll also need iron supplements for the hemolysis. Her red blood cells are starting to break down.
Start her on 0.25 milligrams of calcitriol while you're at it.
I'll schedule her for radiation.
Hi, how are you feeling? I don't know. A little better. So what's wrong with me? Well, my colleagues think you have cancer. And you don't agree with them? I think it's possible, but I also think you may have another disease. So I want you to get a TTE, a TEE, and an ECG. What are those? Nothing scary, just an echocardiogram and an electrocardiogram. They'll give us a good idea of whether or not you have heart disease.
Can I speak with you for a second, please?
Okay. Just give me 1 second, please. Okay.
What exactly do you think you're doing?
I'm just trying to comfort Rachel, that's all.
How is second-guessing my judgment going to comfort a dying patient?
I think she might not have myeloma, that's
You
all.
should know better than anyone. Hope cannot be birthed from faucets.
Look, I'm just going to run a few tests.
Don't bother. There's no heart disease. There's no cardiac arrhythmia. We didn't hear any murmurs, and the blood test didn't show any elevated white blood cell counts. You should be telling her about the bone marrow treatments and the lifestyle changes she's going to have to make.
Fine. I'm sorry about that. So what's going to happen to me? Well, we think you have a cancer that's destroying your immune system. To help treat this, we're going to perform a total radiation therapy, which will ablate the bone marrow that you already have. This way, we can perform an allogeneic bone marrow transplant from your sister and rebuild your immune system. I'm so scared. What do you think my chances are? At your age, with today's medicine and a couple lifestyle changes, I'd say that you have a 90% chance. Don't worry. You're in really good hands. Okay?
You know that patient born a few days ago? By saying no when you leave? Turns out she had melanoma at age 18. Interesting. But we already irradiated her and transplanted her sister's HSCs. Is that a fact? You might want to go check on her then. Why?
Rachel's comatose.
Yellow sclera.
Swollen ankles.
It's jaundice.
Becoming cirrhosis very quickly by the feel of things. Fluids pooling in the abdomen.
Wait, what's this?
It looks like a rash.
Could have pruritus and have irritated skin.
Yes, because comatose patients scratch their backs.
We should biopsy the skin to test for all possible causes.
With the state of her immune system, there could be any number of infections. Not to mention there are over 600 causes for rashes. By the time we narrow it down, she'll be long dead.
We need to find House.
She has hyperacute liver failure and has lost function in over 65% of her hepatic cells. We need to think fast. It's only a matter of time before it spreads to the rest of her organs.
Has to be graft versus host disease.
Rachel's been successfully put on the Mars system for dialysis. They found that the rash had spread to the rest of her back while hooking her up.
It matches graft versus host.
We should transfer her into the isolation room of the ICU. We should start her on corticosteroids, both prednisone and cyclosporin, as well as a regimen of amoxicillin. Hopefully, if we're lucky, she won't get pneumonia.
What are we going to do about her jaundice?
Well, there isn't enough liver left to biopsy.
And we can't perform an MRI while she's hooked up to the dialysis machines.
She's still too anemic for exploratory surgery.
We have to use CT scans. Hopefully, we'll be able to find the blockage with enough detail.
I'm sorry, the patient just coded. The infection rushed her, spread to the rest of her heart. Her body just couldn't take it. Time of death, 7:47 a.m.
It's never lupus, is it?
I can't believe we completely missed the diagnosis time after time. How can we call ourselves doctors?
Lupus is almost impossible to diagnose. No one could
You're
know.
wrong. House would have known. We should have known it was autoimmune from the very beginning. Even after...
We suppressed the lupus with the radiation and the immunosuppressant. The liver failure could have been due to renal damage.
There's no connection. It was lupus all along. We can't let this happen again. Look, there's a lupus symposium. We all need to go.
Welcome to the Lupus Symposium. We hope you find this information useful.
Systemic lupus erythematosus is a chronic autoimmune disease in which the immune system produces antibodies against itself, especially against proteins in the cell nucleus. It can affect any part of the body, though the cells and tissues most often harmed are of the heart, joints, skin, lungs, blood vessels, liver, kidneys, and of the nervous system. It can progress severely to result in fatality, especially if untreated. Unfortunately, because it so easily mimics other diseases, lupus is very difficult to diagnose.
90% of affected cases are women, and it is generally contracted between the ages of 18 and 60. In the United States, lupus is the most prevalent in African Americans and least in Caucasians. 4 in 1,000 African American women will contract the disease, versus the Caucasian rate of 1 in 1,000.
When it does not appear as another disease, initial and general chronic symptoms include achy or swollen joints, high fevers, extreme fatigue, skin rashes, anemia, kidney failure, hair loss, problems with blood clotting.
Lupus does not have a cure and is treated symptomatically, usually with corticosteroids and immunosuppressants for immediate treatment, but a cocktail is used in long term to avoid exposure to steroids. In countries where treatment is readily available, the survival rate is approximately 95% in 5 years, 90% in 10 years, and 78% in 20 years. Survival is much more possible when lupus manifests itself in forms of arthritis or cutaneously, rather than in renal, hematological, or neurologic forms.
Lupus appears randomly due to a combination of unknown environmental factors and the genes of one's immune system. The production of abnormal antibodies by B cell is the trademark sign of it.
Research indicates that lupus has a genetic link, as it runs in families, but no lupus gene has been identified. There are other types of lupus, such as drug-induced lupus, erythematosus, which is a reversible condition that usually results in patients suffering from long-term illnesses. Treatment is simply stopping to treat the patient with the drugs that cause the episode of autoimmune disease.
Lupus can manifest itself in abnormal apoptosis, and cellular antigens exposed during apoptosis incite an immune response. Diagnosis is usually accomplished with a thorough history, a physical examination, a complete blood cell count, a chemistry panel, and a urinalysis. Testing antibodies helps to confirm the diagnosis as well.
To assist physicians in the diagnosis of lupus, the American College of Rheumatology has created 11 criteria. They are as follows: malar rash, which is a butterfly rash on the face; a discoid rash, which consists of coin-shaped lesions which are due to the patient's photosensitivity; oral ulcers and arthritis are also classic signs of lupus.
The final 6 criteria for lupus are renal disorders, neurologic disorders, hematologic disorders, anti-nuclear antibody production, serositis, which is an inflammation of the serous tissue in the body, and, obviously, immunologic disorders.
If someone suffers from at least 4 of these symptoms, the diagnosing physician has great reason to suspect lupus. The patient's history is so important because the symptoms do not necessarily have to occur at the same time to be counted as the 4th.
Lupus comes in flares, and certain preventative measures can truly ease one's life. They include avoidance of excessive sun exposure, regular exercise to prevent muscle fatigue and weakness, immunization against specific infections, not smoking, avoiding alcohol consumption, and having regular checkups.
Systemic lupus erythematosus is not a disease to be ignored simply because so few details are known about it. Rather, it is the reason that it must always be ruled out before other diagnoses are concluded. It is for this reason that several hundred thousands of cases are ignored every year, and it is for this reason that hundreds of people die from unknown diseases every year.